So nursing homes feeling the brunt of the COVID-19, countless deaths, parents and grandparents isolated for months, unable to see their families.
It's certainly been tough and difficult, right? So when they do get to see each other, there is a plastic barrier or glass windows and doors dividing them. But now the number of COVID cases on the decline and more senior citizens and their family members receiving their vaccines. Family finally being reunited. Joining us now to discuss this is Michael Balboni. He's the executive director of the Greater New York Healthcare Facilities Association. Good morning to you, Michael. Good to see you.
Good morning to you, too. Thanks for having me.
So this is so big for so many families, especially senior citizens, right? They just want to be able to hug their sons, daughters, grandkids. The Centers for Medicare and Medicaid, though, they're working now with the CDC, releasing some new guidelines for folks. So what exactly do those entail?
So the CDC has announced that visitation can resume, particularly in counties where the positivity rate is below 10. But you still have to have the same type of precautions that you have currently. So you got to know who's vaccinated. You've got to screen all visitors and residents. You've got to make sure that everybody's wearing PPE, that there is social distancing. But the big changes is that now it's almost as the CDC is and the CMS is actually encouraging visitation, saying you can visit anytime, all residents, as long as you adhere to these guidelines. And this is really new. What a lot of people don't appreciate, because they weren't on the ground in the nursing home situation, was last March is when all the nursing homes in New York and basically the metropolitan area basically decided that we were not going to allow folks to come into the nursing home from outside. And so it's been since that time that we've really stopped this type of visitation. Right. And it's such a part of care that you really need it.
So is the concern that when neither the resident nor the visitor is vaccinated, that it could lead to an outbreak there?
Yeah. So, again, it's only going to happen in counties where the positivity rate is very low. And the belief underpinning this decision by the CDC is that this is the vaccinations, the decline in infection rates, that this has set up a probably the best scenario we've had since the beginning of the pandemic to have this kind of interaction again. You can't stop all the protections that are necessary, and you want to try to prevent it. But at the same time, they believe that it's worth this change in regulation.
So we see the numbers going down across our area, right? That is why so many things are beginning to reopen. There's an increase in indoor dining. What are you seeing when it comes to actually nursing home outbreaks? Are those numbers on the decline? Is there still an outbreak issue?
In New York, it's a very sporadic issue that sometimes you'll have a nursing home that will have a resident a staff member will come in, they'll test positive, but it doesn't really lead to outbreaks. And then nationally, there are statistics that talk about an 80% reduction in infection rates and a 60% reduction in deaths among nursing home populations. So it really is moving in absolutely the right direction.
Yeah.
So what's your reaction, though, to reports that the Cuomo investigation tweaked the numbers underreporting the number of deaths at nursing homes across the state?
So we always believed that there was a problem with some of the numbers and when they came out, just because of the numbers that we were hearing from our own membership and what they were reporting. The challenge here, besides what the motivations might have been for doing it, is that in the middle of a pandemic, you need as much real-time information as possible, and you need it accurately, so that you can assist people with the responses. And so, unfortunately, this is something that we know now the numbers weren't correct. It would have been better if they obviously if they had been accurate. And going forward, we want to make sure that we have a good reporting system that is as accurate as possible, so we have all the information we need.
Yeah, numbers are key here to keep people safe, and we knew that from the very beginning, right? And I'm sure so many family members are just feeling that the brunt of that outcome here. Excuse me, I do want to ask you about parents and grandparents who have been isolated for nearly a year. Excuse me, I hear it in my own grandmother's voice that she sounds sad, right? She hasn't been able to hug her grandkids. You're not able to see your loved ones. That's what keeps folks who are elderly going, right? The love of their family. Are you seeing a rise in depression, even suicides?
So, before this, we were really looking at isolation as a comorbidity, loneliness as a comorbidity. And those are psychological factors that need to be taken into account pre-pandemic. Now, post-pandemic, with the isolation that's been happening, it is absolutely essential to get people back into a socialized setting so they can see their family members. And more, you can hug people. There's a provision here that if the resident consents, that they can be hugged. And that human touch is absolutely essential to care. So yes, there is a very increased use of psychotropic drugs, which indicates real issues with mental depression. And this is something that is going to emerge. We don't know fully what the ramifications are from this year-long lockdown, but that's where we're going to be focusing a lot of our attention on.
All right, Michael Balboni, Executive Director of the Greater New York Healthcare Facilities Association. We appreciate your insight today.
Thank you very much for having me.
Thanks,
Absolutely.
Michael.